Can early life interventions stop eczema in high-risk infants? Have you ever wondered if there are ways to prevent eczema in infants who are at high risk? This is a question many parents ask, especially when they have a family history of eczema, allergies, or asthma. Eczema, also known as atopic dermatitis, often begins in early childhood and can lead to dry, itchy, and inflamed skin. The good news is that early life interventions can help reduce the risk and severity of eczema, although they may not completely prevent it. One of the main issues with eczema is the skin's protective barrier not functioning properly. This can allow allergens and irritants to enter the skin, which may trigger immune responses and lead to eczema. High-risk infants, those with a family history of eczema or allergies, may benefit from specific interventions aimed at improving their skin barrier and immune responses. One effective strategy is regular skin care using emollients or moisturizers. Applying moisturizers to the skin of high-risk infants can help enhance their skin barrier and prevent dryness. However, it is important to note that using emollients alone may not be enough to prevent eczema in healthy infants. Some studies suggest that starting treatment with low-dose anti-inflammatory topical agents, like corticosteroids, on both affected and high-risk areas early on can help reduce the severity of eczema and the risk of developing food allergies. Breastfeeding is another important factor. Exclusive breastfeeding for at least 6 months may lower the chances of eczema in high-risk infants. The timing of introducing allergenic foods, such as peanuts and eggs, can also play a role. Introducing these foods early may help promote immune tolerance and reduce the risk of food allergies, which are often linked to eczema. For infants who are not breastfed, using hydrolyzed protein formulas can be beneficial. These formulas break down proteins to make them less likely to trigger allergic reactions. However, the evidence supporting this is still limited and varies from study to study. Another interesting point is that exposure to allergens and microbes during pregnancy and early life can help train the immune system. This exposure may help the body develop tolerance instead of allergic responses. Supporting the skin barrier right after birth is a key strategy in preventing eczema and related allergic conditions. In managing pediatric eczema, early identification of high-risk infants allows for timely interventions. Creating personalized skin care plans that include moisturizers and, when necessary, mild topical anti-inflammatory treatments can help control eczema. Encouraging exclusive breastfeeding and the timely introduction of allergenic foods can also support immune tolerance and lower allergy risks. While early life interventions can significantly reduce the incidence and severity of eczema in high-risk infants, they do not guarantee complete prevention. A combination of skin barrier support, immune tolerance promotion, and tailored treatment approaches offers the best chance for managing pediatric eczema and its complications.